last week we talked about Health and Human Services Secretary Robert F. Kennedy Jr.'s Make America Healthy Again initiative. Well, this week we're bringing it a little closer to home. Let's welcome back our source for all things balanced and natural, Dr. J.P. Saleeby, Medical Director for Carolina Holistic Medicine. We're glad to also welcome Chris Jackman, Nurse Practitioner at Carolina Holistic. Good to have you both with us again.
Great to be here.
Really enjoyed our conversation last week when we were talking about what sort of the envision, what the initiative is behind MAHA, Make America Healthy Again. You're part of a system that's bringing this a little bit closer to home, which we desperately need here in South Carolina.
Right.
Yeah,
it's more grassroots, more at the state level, local community level. So we're taking the principles of MAHA, how to make America healthy again, and we're taking those key points and bringing them more local. So we're working with a group, the South Carolina Physicians for Freedom, and we're doing a Make South Carolina Healthy Again.
Yeah, I like that. Where do you think South Carolina is falling behind in compared to other states when it comes to our health?
Well, I think if you look at some of the statistics, Louisiana, Mississippi, South Carolina is ranked in the lower half when you compare to the other 49 states. So we have some catching up to do. I think it's somewhat cultural. I think it's our diet especially.
Sure.
So if we can tackle that right up front, I think we'll be ahead of the game.
Are we talking about diabetes, heart disease, Alzheimer's?
Yes.
All the above?
So all chronic illnesses, and there's a bunch of them. You can look at our rise because we're in the fried chicken belt, if you will, along that swath that goes around the states. It's like, again, it's a cultural thing, and if we can address obesity, diabetes, renal failure, kidney failure, heart disease, Alzheimer's, Parkinson's, those neuroinflammatory diseases, I think we'll get a handle on things.
Yeah, and as a nurse practitioner, tell us a little bit more about in your own practice and seeing patients and sort of where you want to see your patients go, or just South Carolina at large in terms of their health?
Yeah, I think one of the most important things is giving patients choices. You know, no mandates, not making them have to choose to take a certain route, but let them decide if they want vaccines, if they want to go traditional medicine or alternative medicine, if they want to avoid prescription medications and use alternatives. So our big goal is to just try to not mandate people to do anything, but give them choices and give them options, and let them decide what's best for their own bodies and their own family.
Yeah, and I know, NPPAs, nurse practitioners, physician assistants, they're becoming more and more prevalent in an age where we're seeing a shortage of doctors, frankly, and so a lot of patients come to see someone like yourself. Is it unique that you are dealing in the world of holistic medicine? Do you have a background like Dr. Saleeby in traditional medicine as well?
Yeah, my background is traditional medicine. I was a nurse in Cleveland, Ohio, originally a nurse practitioner at Cleveland Clinic in cardiac surgery. So came very Western, and then when we came to Charleston, met Dr. Saleeby, and was blown away by what he's doing and what he's able to do to find root cause issues and utilize alternative medicine. So we like to think we have a foot in both the Western and Eastern side of medicine, so we give you kind of the best of both worlds.
Right. Where does it begin for you, Dr. Saleeby, to change everybody's thought process and the culture, like you said?
Right. So this is almost a 30-year journey for me. I mean, I didn't just start at the onset of the pandemic with a change in my philosophy.
Right.
It goes back to the late 90s. And I've been working on an educational program to train other advanced providers and doctors and chiropractors and acupuncturists. Chris happens to be the first graduate of our certification program, which happened a little over a year ago.
Oh, wonderful.
He became certified. So he's very well trained up. He's one of our most exceptional practitioners in our practice. He's my right-hand guy. So, we can be a little bit critical of both worlds because we've been exposed to both the strict allopathic and the alternative or complementary. So we know what best to pick from
Right.
for each patient. It's very individualized. You can't do it in a 15-minute visit. So we have hour and a half visits with our patients to get to know them really well, and then it's a collaborative effort.
Right.
You know, we don't mandate by fiat. You know, we're
Sure.
like, let's get together, put our heads together, and come up with the best plan.
Yeah.
And people are very happy with that.
It's good to hear that, and perhaps, you know, with time and enough repetition, we're going to see it spreading throughout the state. But you had mentioned the South Carolina Physicians for Freedom group. Tell us briefly what that is.
Well, it's a collection of 5 founding members throughout the state, most of them actually in the upstate, around the Greenville, Spartanburg area. And we all got together a couple of years ago and found this organization. Several of us has gone on tour to speak to groups, and we're planning to do more of that to make people more aware about health care and the changes we're pushing for, more transparency, and to be a system that's less captured by those with an agenda, like to make money with pharmaceuticals, for example.
Right, yeah. And you're going to take this on tour eventually.
Yes, yeah, we're planning, we're in the early stages of planning to take it to all parts of the state.
Wonderful, wonderful. So how do people find out more information? Where can they go to follow you?
Sure, so SCPFF, they have a website, it's a nonprofit organization, and then Carolina Holistic Medicine with us.
Great.
And you know, we can direct people if they make inquiries where to get more information.
That's wonderful. It's a new age. Yeah, it's time to evolve, isn't it?
It's exciting.
Yeah. Dr. Saleeby, Chris, great to have you both with us. We'll be back after this.